BB is a 17-year-old female that was brought into the clinic by her mother with a suspected eating disorder. BB complained of bloating, decreased energy, and a sore throat, which are all symptoms of bulimia, with a sign of edema in the ankles. There are several signs that predispose this teen to bulimia in her history, family specifically. This would include the parents' divorce, the sister having ADHD, and the actions that she takes against BB of hitting and biting, and also the frequent housing changes that BB undergoes between the mother and father. The father's current girlfriend is critical of the teen in the aspect of school, friends, and her current weight, which does not help in this case of a suspected eating disorder. The teen reads popular magazines regarding celebrities and the risks they take to define an attractive body. The mother and grandmother have a history of depression, as well as the mother having a history of anorexia as a teen. According to the patient's height and weight on the BMI chart, she is of normal, healthy stature with a BMI of 21.1. This can happen with bulimia patients, as a reported normal height and weight are demonstrated, as they still have frequent vomiting episodes. The patient demonstrated tachycardia and Russell sign on her fingertips. Russell sign is when an individual has lesions on the fingertips due to repeated contact of the incisors and skin from self-induced and vomiting. The patient is afebrile, and the sodium, bicarb, bun, and creatinine levels are all within normal limits, as well as the skin turgor being normal, which are signs of normal hydration. The pH of the patient is 7.48, which is slightly high. Also, the amylase laboratory result was high at 240, from 20 to 110 being a normal result. The results that were low are the potassium, chloride, magnesium, albumin, hemoglobin, and hematocrit. Metabolic acidosis with hypokalemia may be suspected due to the levels of the potassium, chloride, and hydrogen being abnormal, with the values being lost in the frequent vomiting of bulimia patients. The abnormal hemoglobin, as well as the glucose level, could be a result of the patient being tired and fatigued. Iron being abnormal can have a direct effect on the result of a hemoglobin level. The clinical data presented in case study 97 suggests a purging type of bulimia, as many of the lab results, along with other clinical data, suggest that purging is supported. This would include the access and exercise, the Russell sign, as talked about earlier, the increased pulse, and the potassium, chloride, hemoglobin, and hematocrit levels all being low. Parents can help prevent an eating disorder develop by talking and listening to their children. Communication is an intricate part of parenting. Paying attention and being involved in the lives of your children are all very important. Being able to read the unsubtle signs that the child is trying to relay can prevent many problems that teens face today. I feel that being encouraging in every aspect of life is crucial. You must not make a child feel unwanted or unloved at any point, because they will turn to disruptive behaviors to gain that attention back, much like an eating disorder such as bulimia. That concludes case study 97. Thank you.